With the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America
and to the republic for which it stands,
one nation, under God, indivisible, with liberty and justice for all.
Before we start the meeting, we do not have a quorum at this point in time, but I'd like to announce that Mark Bullock, who has been our president for many years, has finished his second four-year term, a total of 8 years in office on the Board of Health, and consequently, by rule, is ineligible for reappointment to another consecutive term. And I'd like to formally express on behalf of the board my appreciation for Mark's service to our township. He has really been an exemplar of public service and has devoted a lot of time to this board. And I hope, if he's listening, that he's heard that vote of thanks, and I'm sure that the township commissioners would echo that. I don't know if, John, on their behalf, you would want to say anything?
Well, I guess I do. I want to personally thank Mark for his service to the township over the last 8 years. Quite frankly, I like to bend the rules for him to keep him on. But Mark, if you're at home listening right now, thank you again for your service, and I hope, wish you the best in everything that you do. And I imagine, I don't know what the opportunity is for him to come back at some point. I imagine if there's a lapse there that he could come back in some capacity. So thank you again for your service to the community.
Thank you. And in addition to Mark Bullock, Denise Malkovich, who has also served on the board for 2 consecutive terms, is likewise ineligible for appointment to another consecutive term. And in answer to your implied question, John, my belief is that once you've had a 4-year lapse, you are eligible for appointment in the future. But I would also like to thank Dr. Malkovich's efforts, and I'm sure that she has indicated an interest in continuing to serve in some other capacity in helping the board to address issues that she has some expertise in. With those, especially this meeting would be an organizational meeting for the board, which means that we would normally be electing officers for the following year. However, in the absence of a quorum, we can't do that at this particular time. So I'm going to move to ask Mr. Taltone to provide his portion of the meeting, health officers' reports, and any other announcements.
Thank you. Thank you, Mr. Hazen. Before I move too much further out of this area, if the board members will look on their list that I put up there at the last minute regarding the board terms, just for point of clarification, it shows your name as expired of December 31st of last year also. The reason why you're still eligible is because you filled an unexpired term of someone prior to you. So you're allowed to, in addition to that unexpired term, to fill 2 full terms. So I just wanted to point that out.
Thank you.
As far as the health officer report, Well, let me back up on announcements. Board member Amy Wishner could not be at tonight's meeting. One of her kids was sick, and certainly she wanted to be here. And moving into the health officer's report. During the year of 2009, we conducted 205 food inspections, 99 bathing place inspections, 26 rental housing, 151 citizen quality of life issues. I maintained certification as a lead inspector, risk assessor, certified food manager, and Pennsylvania certified health officer. I recertified in several other areas, building code official, residential building inspector, accessibility inspector, and plans examiner, and housing and property maintenance inspector. I did that to help out with the shortfall in building inspections that we have currently. I'm also certified in National Incident Management Systems, certified in emergency management, and in advanced incident command. During the year, we had several new food facilities that opened up, conducted plan review, and met with the food facility owners, ensure food code compliance. In October of this year, members of the Delaware County Local Boards of Health, along with Intercommunity Health and the Pennsylvania Department of Health, we conducted our second drive-through flu clinic. We did it in Tenacum County Township Firehouse, and it was for all residents of Delaware County to get the seasonal flu shots. In a 2-day period, we were able to give out 1,200 flu shots, seasonal flu shots. Also, in November of last year, Intercommunity Health, Pennsylvania Department of Health, issued H1N1 flu shots to school-aged children at the Radnor Elementary School. In the Radnor Township municipality, they issued out 1,389 flu shots to children, and countywide there was, I was given a report today that there was between 17,000 and 18,000 doses in Delaware County for the H1N1. We monitored quite a few home quarantines for animals that suffered wound of unknown origin and had to be put on quarantine based on the Department of Agriculture and the township's regulations. The West Nile virus for the year of 2009, in Delaware County, there were a total of 17 positives, no human cases in the state, and 16 positive samples in the county. One positive bird. So ends my report.
Question, it seems obvious on the third bullet on your report, year-end report, conducted 26 rental housing inspections for first time. I assume that means that when a rental housing unit is opened for rent for the first time, that's when you do an inspection?
Yes. What typically happens is when we had the other inspectors, they would routinely split them up. We got a little short-handed, so what was happening was to maintain and make sure that new units that were occurring were up to code. I started picking those up, and this is the number that I did once we got short-handed of all new units.
Is there ever any occasion to re-inspect a rental housing unit?
Yes, once you inspect the rental housing unit, if there are any violations, especially life safety issues, then a re-inspection occurs.
How do those come to your attention?
Well, as far as the re-inspection or the
Yes,
initial?
the need for a re-inspection or violation or...
Well, when you do the initial inspection, you'll do you'll give them a list of those violations, and you'll give them a time to make the compliance. Once they make compliance, then they have to call you for call us for a reinspection. Or if that time lapses and they do not call, then we initiate a call to say, we have to get back in there.
I guess my interest is whether, I mean, let's say you clear the unit for occupancy, and they've met all the qualifications for that clearance. Is there ever any time down the road turnover in the occupancy or anything of that nature?
We'll do them in sequence of order. In other words, we'll go down the list, and when your number's up is when we'll call you and say, we need to do a rental housing inspection. So we kind of put them in sequence, with the priority being on new units.
Thank you. Any other questions for Mr. Talto? I have an additional announcement. As members of the board and the township commissioners know, we had applied to the Rite Aid Foundation for funds, a little over $16,000, to print and distribute an emergency preparedness guide for the citizens of Radnor Township. This has been discussed at several previous meetings. Unfortunately, the Rite Aid Foundation has written back to us just recently indicating that they are not in a position to approve our application for funds. So at this point in time, we do not have the funding to go ahead with that project. I would like to be able to continue to pursue that, but we would have to find an alternate source of funding, and I'd like to ask my colleagues on the board to put on their thinking caps and see if we can come up with an alternate source of funding for that. I continue to believe this would be a very important thing to be able to provide the citizens of our township.
Is this me? I think the proposal was written before I came onto the board. Is there any way that you could send that over to me or us electronically so we could get a sense of what the proposal and the budget look like, so we could think about some funding sources for you?
Absolutely.
And then also, has it been posted, or could we think about posting it on the Radnor website to, at least in the meantime, get it out to residents, or are we holding back for a distribution of mailing?
I'm not sure about, well, two things. One is you will get a copy of the proposal. The emergency preparedness guide is rather large when it's unfolded. It's not a one-pager or anything like that. It contains maps, for example, of evacuation routes and that sort of thing. It doesn't readily lend itself to doing it online, but we can certainly look into that, and I can work with Larry in looking at that possibility. But again, that's something that we thought of before, and it's a sort of thing that unless the residents downloaded it by looking at it, it might not be as useful as having a hard copy when the time comes that you need it. Since we do not have a quorum, we don't have the opportunity to approve any minutes of previous meeting. So we'll pass that as well. Under old business, The EAC update, members of the board have been, I trust, receiving the minutes of the Environmental Advisory Council, and as well as other pertinent information that from time to time I've been getting from the EAC. And I send those out through Mr. Taltone, who distributes them to the rest of the board. So I think that's a fairly efficient and effective way of keeping everybody immediately up to date on those issues. Medical environment and healthcare access is an item that Mr. Bullock traditionally has handled, because he has been someone who has kept up to date and on all of the issues, for example, with healthcare reform in the country, and has kept us all up to date. We'll have to find another way of doing that for future meetings, but right now we don't have that report. Under Radnor Health Matters, the initial segment that has continued to be aired on 2009 and seasonal H1N1, and so residents can continue to look at that. At the same time, we are planning to tape another segment on human papillomavirus, and which is the virus that causes cervical cancer, and the vaccine that's available to prevent that. The date of the taping is scheduled for February 10th in the morning, and Amy Leader, as one of our board members, has graciously consented to be a part of that segment. Is there any new business? Hearing none, then we'll move on to item 9, which is vacancies. Obviously, with Mr. Bullock's and Dr. Malkovich's departures, we have 2 additional vacancies, and I would ask all of the board members and township commissioners certainly to think of possible replacements for those individuals, or I should say successors. They can't be replaced. But we certainly need to have a full complement of board members. And with that, I guess we have concluded tonight's meeting. I would ask that board members think of nominations, and anyone who's interested in serving as president and or vice president of this board, email me. You have my email address on this, and let me know so that we can present some names in nomination at the next meeting. Hearing no further business, Dr. Ballard.
Just wondered, I guess I had seen some of the comments about the reason that we didn't have a scribe, and I wondered whether that was going to be ad infinitum. It certainly would be discouraging for somebody to be president and scribe at the same time, and I think most of us wouldn't be real thrilled at doing that. And we had the luxury of Mary Ann doing it for the last 20 years. I guess we're spoiled.
Well, that's a good question. I came to this meeting thinking that Mary Ann Cassidy was going to be assigned back to us for that purpose, but apparently there's been a change in that since, and I just learned that this evening. And you're entirely right, Dr. Ballard, that is discouraging. I'm not really good at taking notes and conducting a meeting at the same time, and I've been trying to do that during this meeting. So it does seem like an additional burden for any member of this board, but until we do have someone, we'll have to muddle through on that. But I thank you for your comment, and I concur. Okay, then if there are no further items of business, we'll adjourn the meeting.